Hi everybody. Now let's get to the second phase. You saw the muscle testing. You saw the positive effect that these products can have on your body, plus a few other things I showed you. They're passively done that will help you. Now we want to go into more detail. I'm Dr. Vetanze, Chiro Guru. Thank you, 3 million hits, and thank you, 9,000 subscribers. We want to keep trying to help and present to you things that are going to help you maintain your health.
I'm Dr. Roger Smith, a GPA certified practitioner who works with Dr. Vetanze now here in Aurora, Colorado.
And I'm Lane Radbill, Marketing Director for Receptra Naturals here in Denver, Colorado.
This is the second phase of it. You saw previously what we did in the other room. Why are we doing this? Everybody's looking for, hey, let's adjust the feet. Hey, crack in the crack. Move your junk. Well, that's fine, and I appreciate you appreciating that, but let me tell you more. Now we have so many viewers from really all over the world. This was never started to be a business-making or money-making proposition. This whole YouTube videos for the Chiro Guru was because I thought I couldn't work anymore because of 2 hip surgeries. And I thought I'd make videos in case so somebody could see them and carry it on because I thought it was pretty important. Well, I had my 2 surgeries. I discovered CBD as a product. I discovered other things that I do for me that help me. And I want to present that to you. You're always asking me, where is there a chiropractor in my neighborhood? And I've had all over the country, all right? And I have to say, no, I'm sorry, there's not. I don't know who to send you to. Come to Denver. So I wanted to introduce some passive things you can do to temporarily relieve your pain. It's not a lot, but it's all you really should be doing on each other, families or whatever, but it gives you an idea that what you can do to take care of some acute or chronic pain, balance you out, and let your body heal. Likewise, I thought it was very important that I continue to introduce you to products that I think that had the most important impact on my life and my health. And this is the Receptra products, the creams, the topical cream, and the oils. And now we're going to talk about that. So here we are with our products from Receptra, as you see on the screen. I take these products every day. We sell literally dozens of jars of the pain cream, dozens of jars of the body butter for every skin condition, all right? This is for you to benefit, not for any other reason. This is something I recommend that you try and do for your overall health. Lane represents the company from Receptra, and he's going to tell you about some of these products.
So CBD products from Receptra Naturals are all organic, and they're made here in Colorado. We have 2 lines of products, the Health and Wellness Pure CBD products, and then we have 3 different strengths of the Active Lifestyle products, and those are Active, Elite, and Pro. 3 different strengths ranging from low to high to help you with addressing different challenges that you may have with your health and wellness. And then, as Dr. Vetanze mentioned, we have a pain cream called the Targeted Topical, which is really great for acute and instant relief from aches and pains, muscle and joint irritation. And then a body butter, which is similar to a moisturizer, but it includes 400 milligrams of CBD and is great for healing just minor abrasions on your skin, swelling, and really any kinds of discomfort you may have on the surface of your skin.
Now, the 400 milligrams in your topical product, I've used different products. I'm always searching for better and the best. I wouldn't do anything less for my patients. That's just what I insist upon. Mm-hmm. You have 400 milligrams of CBD oil?
Right.
Isn't that the most I've ever seen in any CBD?
Definitely. This is an industry-leading inclusion of CBD. So 400 milligrams, highly concentrated. But it's only coming in a 1.5 or 1 1/4 ounce container. So it's very concentrated, and you're not getting a lot of fillers. There's no artificial anything. But the important thing to take away there is that it packs a lot of punch with using a little bit of product. So we're not, you're not putting extra on your skin to get no results.
Now, I see a lot of products. I like Amazon, I'm always on Amazon buying stuff, and I see tons of these products. I have nutritional experts coming here all the time with different products. I'm bombarded daily with phone calls, emails, pamphlets, whatever else. And it's an overlap. I mean, there's 22 different types of coenzyme Q10. There's 42 different types of vitamin D. I'm like, what? Some have a higher quality ingredients, some don't. You see a lot of propaganda of this product has this product is poison, this product comes from here, this product killed 14 people. So quality control is utmost important. How much does this topical cream cost retail to the?
The targeted topical is $39.95, as well as the body butter. Both of our topicals are the same price.
400 milligrams of CBD oil for $39.95?
Right.
It should be much higher than that.
So what's that, like 10 cents per milligram?
It should be much higher.
But
that's a deal.
that's part of our philosophy too, is that, you know, there are a lot of competitors out there that are trying to make a killing on this oil and the CBD, but forgetting about the wellness aspects and forgetting about what the purpose of the products are. So we, you know, developed our business model to make sure that we were allowing entry for as many people as possible and creating effective products as well.
So this, pain, muscle spasms, physical pain, put it on the body.
I mean, the idea is that you would take an oil daily as a sort of maintenance behavior routine, right? And after a few days of taking the oils, you'll notice that things like inflammation or, you know, creakiness, aches and pains that you have in the morning or throughout the day will subside. But then there are those days where, you know, you have flare-ups or something is particularly uncomfortable. The topical is great for that, for immediate relief from aches and pains, and it is an acute application, so you're, you know, targeting exactly where you want to go with it.
I second that. It's miraculous for me, and I'm old. Okay, the body butter. Now I know you talked about it, but I tell you what, since I've been using it, I use it every night and every morning. Okay, and my skin is just smooth, soft. It gets nourishment. I put it on my arms for my brown spots and get a little older. I put it on my legs. And, you know, my wife, she does these creams all the time. It's a beauty trend for most women. Give me my lotion. And I use this as my lotion, but it seems to do more than give me a nice soft feeling. It seems to help my skin, heal my skin.
Yeah, but, I mean, that's the idea of the CBD.
There's how much CBD is in here?
There's also 400 milligrams of CBD in the body butter.
Wow.
And, you know, the difference, you can see that one is larger than the other. This is more of a salve or a balm, and this is whipped, like a body butter. And so the idea there, again, is the CBD does interact with your skin, and it provides protection as well as some healing properties, right? So, you know, the jojoba oil, which is in the formulation, is also shown to protect and enhance the skin's ability to heal itself.
Jojoba.
Jojoba,
Yeah, I've been around for a long time.
So,
yeah.
you know, it's good for blemishes, like you're saying, and I think that people are discovering applications for the product that, you know, maybe we didn't consider when we first made it. It says body butter, but you're putting it on your face. I put it on my face.
Yeah.
You're gonna put it on your face after tonight, right?
Put it on my face tonight as well.
So
Absolutely.
yeah, and just hearing great feedback for finding new spots to put the butter.
Well, you know, I've been using it for a year. I think Dr. Roger, we treat many patients, many athletes. And there's always soft tissue complaints. It's difficult to keep this in stock. Everybody's always asking for it.
All the athletes really want it because their injuries are so acute, and they want to treat that and take that inflammation and that pressure off those joints. And they find that this works really well. And they're always asking for it.
Now, you have 5 bottles, different levels. The lowest is?
So the introductory product is the active, which is 15 milligrams of CBD per serving. Then the middle is the elite, which is 30 milligrams of CBD per serving. And then the top strength is the Pro, which is 60 milligrams of CBD per serving. And those are all in our active lifestyle line, which is really focused on anyone that, from professional athletes to just hobbyists, people who are trying to maintain their physical fitness on any level. And then on the other side is the health and wellness, which is more focused on the medical community and people who are trying to address certain challenges related to their health. And the difference really comes down to the purity of the formulation. And don't be scared to think that one's more pure than the other. It's just simply that this is CBD and MCT oil, which is the carrier.
What's MCT?
Medium chain triglycerides. So if you're talking about long amino acids, it's about the prioritization in your body of what your body's going to burn for energy first. So long chain would be last, and medium chain would be before that. So the point of using MCT oil is it helps with metabolism, which helps with getting the CBD into your system more efficiently and speedily.
Several years, 3-4 years ago, I watched a movie about a young boy who was having 300 seizures a day. I met this young man, and accidentally or planned, they were out of options. They were actually the parents were having to sign a form through the government that you can take this drug to help these seizures, but it probably kill your kid. Do you want to try it? And the parents signed it, and they were giving this young man drugs to try to stop his seizures, and had to sign a waiver that your son's probably going to die. It was 300 a day, I understand, 300 seizures a day. I don't think the boy ever slept. Then I saw this young man on the video after they stopped that and started CBD oil. It's like almost immediately his seizure stopped. And the young man is now in school, basically normal. I don't know what other care he is having, but this helped him significantly. So, although I don't think I have seizures, we all have brain farts. So I just routinely take some product every day. I take I have the other product, Pro or Elite. I take at bedtime. I sleep 7 hours, boom. And I go to sleep. It's helped me tremendously with sleep. I'm reading a lot of research about more and more they're finding about CBD, epilepsy, for cancer. I'm not sure. What treatments, what conditions that's been confirmed that this helps?
So, like you said, it helps with sleep a lot. And I think the thing to understand, it also helps with focus. But if you're lacking focus during your day, that could be for a variety of reasons. It could be because you're in pain from inflammation. It could be because you didn't get a good night's sleep the night before. So with the CBD helps with getting a better night's sleep. It then helps with focus. It starts this chain reaction of sort of wellness and really balance, which, homeostasis in your body. And I think that a lot of the inputs that we have in just everyday life, whether it be the air we breathe or the food we eat, we are at risk of inflammation from the toxins, from the environmental risks that are out there. And so we need to be actively trying to get our bodies back in balance so that we can have a better night's sleep, so that we can work a full work day, so that we can perhaps exercise or play with our family or kids and not be in pain. And so that's how, for example, something that can help you sleep also can help you have energy throughout the day. It may take your mind off or your body's focus off of the things that are inhibiting your ability to be you.
So they're doing more and more research. So you touched on something. Any of you look, research, Google inflammation. They're relating inflammation to everything. All diseases, okay? The body's not functioning right. Instead of alkalinity, you have acidity. Don't eat sugar, don't do this. The air is poisoning you, the water's bad, chlorine, well, it doesn't stop. That's acidity. Your acidic body, you get sick. That's inflammation. So we take all these things, alkaline water or whatever we have to take to cause alkalinity in our body, vegan diets, no sugar, no carbs, this diet, that diet. So what you're telling me, if this subdues inflammation, then there's ingredients with your purity as well as the CBD oil that keeps us alkaline. So this can keep us in an alkaline state. That's probably why when I go to bed, my brain is really relaxed. I'm done. I'm gone. I sleep. I get up. I feel great. And it's been a beautiful healing thing for me. But how many conditions now, if everything's related to inflammation, I mean everything, then this helps a lot of different conditions, doesn't it?
Right. I mean, it is definitely a thing that someone says, does it help with this? Does it help with that? And the answer is always yes. You get some skeptics, but I think the thing to remember is that this is one of the oldest plants, cannabis, hemp, and it's natural. And so, you know, we're really getting back to what our body needs to exist in a balanced state, right? You know, it's not that it addresses conditions specifically, but it addresses our need to perhaps fend off any potential threats.
Yeah, but I think, well, even more so, people come in to see us, they're inflamed.
Always inflamed.
Always inflamed, right? And so we can give them their chiropractic treatment, their GPA, put them on therapy, give them home exercises, but if they don't stop doing, poisoning their body and causing acidity, it makes our job a lot tougher, doesn't it? But once they start feeling better with the GPA adjustments and the alignment, and start feeling better by taking something that makes them alkaline, all of a sudden they see the light and it's like, hey, okay, let's get going now. Let me take care of myself. It's tremendously important for our practice. Yeah.
It probably leads to a lot of back pain and things like that too, that I think people begin with either seeing you or they start with trying our product. And I think what we want to have you understand is that it should be the whole picture, and that, you know, some of this you can do at home and some of it you can't. But
and we do a lot of therapy for soft tissue also. We have a pulse electromagnetic frequency machine. We can do iontophoresis. We have the Simulcare, which does 7 therapies simultaneously. We place the pad on the body and turn on electrical current. You get E-stim, you get microcurrent. We use this as our conducting gel. So we're actually putting it on painful areas, spasm, tendinitis, inflammation, soft tissue inflammation. And we're then pushing it in with the current into the follicles of the skin. It seems like it gets absorbed, because after 15 minutes, these people get up and like, oh my God, my pain's gone. The muscular tendinous pain, right?
Absolutely.
Then, as you saw in the previous video, we can now use it, put it on a painful area, and the legs even up. Dr. Roger and I discovered this the other day, and we were working, and we're always studying and learning, talking to God, please help us, God. And so we used this product, and like, hey, your legs just balanced out. No way. Do it again. And I said, all right, took it away. You wait about 10 seconds, and the short leg syndrome came back, as you saw in the other room. And then we put it right on where the pain was, L5 to the right, and he's laying there, and as you put it, the body communicated, the energy, the innate intelligence of the body, chiropractors, that you're always preaching and talking about, okay? The innate intelligence of the body, boom, corrected it, and the leg lengths evened up. And we did it over and over and over. We can muscle test it. You become stronger when we muscle test it. But the body, in its own innate intelligence, its governing force, said, I like this, and evened up the leg lengths. It was amazing.
How do I get started? I mean, I don't sleep well at night. Where would you recommend that I start?
So,
I'm scared that I'm going to get high.
Right.
So
yeah, we don't want to get high.
We don't want you to get high. CBD, first of all, is non-psychoactive, so you don't have much risk of that. But with any cannabis-based product, even hemp, there's a chance that if you were to drink the whole bottle, you'd feel a little euphoric. So for people who are starting out, especially trying to address sleep issues, I would recommend the Elite product. And the Elite is the middle strength on the active side, and we recommend that adults take between 2 to 3 dropper full per day.
Okay.
And one good piece of advice that I give, if this is your first time starting out, you would want to take it maybe an hour after dinner, so that the worst case scenario there is you have extra energy and you're up maybe an hour or two later than normal, but nothing drastic. Or you go to bed a little bit earlier. If it really hits you and makes you sleepy like you wanted off the first try, then you go to bed early. And the point there is it takes a little bit of time to sort of acclimate to the product, to your body to say, oh, wow, this thing has not ever entered my system, ever. But it's been around, we have an endocannabinoid system, which is what
Yes, we do.
interacts with CBD. And we've deprived our bodies of cannabinoids because of, laws, essentially.
Okay.
And so, yeah, there's a chance that initially it'll give you energy when you're looking for it to give you sleep. And like we talked about earlier, you will, by addressing the acidity and becoming more alkaline and becoming more in balance, you will eventually get that good sleep when you want it and have that little bit of pep energy in the morning if you want it.
And Dr. Roger, my personal experience, because, once I start doing this, I'm on my experimental stage, right? Well, let me see this, let me see that. And I guess that's how GPA got discovered, right? And that's why we're together, and how you discovered so many things using the intelligent bioengineering type of chiropractic, where we learn. We listen to energies from the body. We just want to help people. And so when I start taking this, if I would be listening to music, I take it, the music was just wonderful. I'd be reading, listening to music, I'm like, oh God. I meditate, I just feel a sense of well-being. Then, if I'm writing a medical report, if I write them out, I'm like, oh, you know what? This makes sense. It adds to my focus and to my expansion of intelligence, so to speak. I think what it does mentally is takes away some of the blocks that we're worrying about all the time.
Yes.
I'm a nervous, hyper kind of guy. I'm a type A. My brain never stops, unfortunately. I don't know if I had hit in the head too many times, whatever, it just doesn't. It's always thinking, always trying to do something. What's this, what's that? And this, now if I take this and I want to worry about everything, my worrying will become much more compounded.
Clear?
I mean, like, stop worrying. So you have to say, no, I'm listening to music, write my report, meditate, talk about chiropractic, work on patience. Some of the things I have discovered is because my brain is relaxed. That's the reason I can sleep. So it takes my flutter away. It takes my aggression, my mini seizures I'm having, because I am who I am. I route these people to walk around, hey, how are you? Real relaxed. God bless you. I don't know how you get that way. Bless you. But guess what? Now I can be that way because I take the oil.
And the thing to realize there is that we're each different. And Dr. Vetanze kind of arrived at this realization of what the right amount of CBD was for him to achieve clarity or relaxation. And we recommend 2 to 3 dropperfuls per day. But for you, it may be different. It may be more, it may be less. You may need a different strength than what you start out with. But the real thing is to understand that this is all about figuring yourself out as well, and making sure that you're in tune. And that's really where you get to wellness, I think.
Now, how much I do Elite. It just seems to be good for me. 1 dropperful, maybe sometime a dropperful and a half. And if we get a lot of kids over for the holidays or whatever, and they're all making a lot of noise, I'll go upstairs, do my dropperful, come down. Hi, everybody. I'm glad you're having a good time. It mellows me out. It makes me be able to handle the situation a little bit more. I don't like a lot of people around, noise. But I do the Elite. The Pro I also do, but to sleep. And you only take 1 dropperful. The Active, I tried Active a couple of times. I took it in the morning before I came to work. And I was clear. And sometimes you try to tell a patient what's going on, especially when you look at their chart and they have 32 complaints, and they want to tell you about each one. And you have to say nicely, you know what? Let me just communicate with you this way. Let me check your body first and see what's going on objectively, and then we can talk. It just helps a more relevant and congenial conversation. At least that's what it does for me. It makes me smarter also. You have all these different products. If you go to drvcbd.com, there you see it on the screen. It'll tell you more about each product. Okay? You can choose what you want for yourself. I do the Elite. You can read about the cream, which is magnificent, the topical ointment, which is magnificent in taking away muscle spasms, pain, soft tissue pain. All right? You can then ask us any questions you want. You can email me on Chiro Guru. We'll do our best in answering any questions. You can call Receptra and talk to them. Am I right?
Absolutely.
Absolutely. And we'll give you that phone number. So